the workplace. So this is part 1 of 4, and I hope if you join us today, you will join us for our next 3 webinars in this series, which we'll talk about today at the end of the webinar. My name is Joanna Forbes, and I'm the owner and the Chief Consultant of Forbes Human Resources. And I want to thank our sponsors today, the Ohio Small Business Development Center, located at Youngstown State University in the Williamson College of Business Administration. So with that, let's go ahead and get started. So just some useful information for today's webinar. I think we're all pretty familiar with webinars at this point. We've been doing them now for a year. But just some reminders for today. Today's webinar will be in a presentation format. There's going to be a lot of information on some of the slides today. Don't feel like you need to write everything down. These slides will be emailed to you in a PDF. We have everybody muted today, but if you could just make sure that your microphone is muted so we don't have any feedback. And please, if you have any questions, please put them in the chat box that Jenna welcomed everybody in this morning. And we will get to those at the end of the webinar. If there's anything we don't know the answer to, or if we don't have time to get to, we will make sure we reach back out to you. So just a disclaimer for today's webinar, this webinar is for informational purposes only, and we're not providing any legal advice today. The information is current as of today's date, and please refer to all referenced websites and your business industry standards for current information. So what are we going to be talking about today? So we're going to be talking about, of course, coming back to the workplace. I feel like we've been using that phrase back to the workplace a lot these last few months, but today we're going to be talking about specifically what's happening right now, because we've all heard the June 2nd date, right? And what does this mean for everybody? We've had a lot of changes in these last couple weeks in the workplace due to COVID. So we're going to be talking about communicating with our employees. The current guidelines, again, as they are today, as we all know, they change daily. The vaccination guidelines for your staff, some reopening best practices, and some of those common ongoing workplace issues that we've been seeing here. And really the last few months have really picked up. And then some policies that you really should consider updating right now, and then some final reminders before we go. So with that, let's go ahead and get started. So we're trying to move beyond COVID-19, right? We've got to the point, we feel like we have some end dates. We're moving past this. Those of us who can return to work and are able to have, but really this pandemic is going to have effects on our businesses for some time to come. Some of them good, some of them maybe just some improvements that we know that we need to make. So at this point, we really have to think how we're going to strive to continue providing that safe work environment. We learned a lot about our businesses and our management practices over the last year for sure. So we have to remain aware of all of the ongoing regulations and things that are changing, but we really have to also think about our specific workplace culture and our industry, because they're all different. Whether we work in manufacturing, whether we work in healthcare, whether we work in a nonprofit, whether we work in an office environment, all of these have different cultures and different industry standards that we really have to make sure that we understand. It's not just a blanket approach for every workplace. So I want everybody to think about, and I'm sure you have been thinking about, how did your workplace change this last year? I'm sure there were some major changes in this last year, but what of those changes do you think are going to stay in place? And what of those changes do we think will go away and we're going to go, quote, back to normal? And what does back to normal even mean? So those are some questions that we have to sit down as business owners and as managers and really think about, because we're not going to probably go back to the way that it was prior to March of 2020. Not everything is going to be exactly the same. And I think that we know that. And in this webinar today, we are going to be talking about some of those policies and processes that we really need to consider changing moving forward. So before we begin, and if any of you on the call have ever been on any of my other webinars, welcome back. Thanks for coming. But you've probably seen me say this before, my rules of human resources, and those are to always be consistent in your practices and anything that you do and you roll out, and to document everything that you do in terms of your employees. So you'll hear me use these two terms over the next 45 minutes or so as we go through the webinar. So let's talk about the ugly before we get into the good, right? As we know, there's been a lot of workplace litigations due to COVID-19. And I just heard an attorney say the other day that in his opinion, we're going to hear the phrase COVID-19 in workplace litigations for years to come, that it's going to be relevant and it's going to come up. So specifically, there has been 2,345 cases in our country that have been specific for COVID-related workplace claims. And sadly, Ohio is the fourth in the number of these cases with 159 claims. So that means there's been 159 workplace claims from employees against their employer involving something that has to do with what happened in the last year due to COVID. So the most common things that we've seen is remote work. That has really been the most common thing, are people who maybe felt like they should be able to work from remotely and they couldn't, whether they weren't paid for the hours that they worked when they were working remotely, and other things that have come from that, which we're going to talk about. There's been leave of absence conflicts. As we all know, there was the Family First Coronavirus Response Act that put the leave of absence in, and there's been many conflicts with that. And discrimination in all of that, what that entails. If somebody felt like they weren't getting the same type of benefit or treatment that their coworker was receiving or that they were owed to as a benefit. So those were the types of litigations that we have seen the last year. The most common industry is healthcare that these cases have come from, but here's the surprising one. Most of these workplace cases were with small businesses with fewer than 50 employees. So that was really the shocker for me. A lot of the clients that we assist with the Small Business Development Center, that's them, less than 50 employees. So that one was really the surprise to me. So what does all this mean? This means that, again, we have got to continue communicating with our employees and keeping our finger on the pulse of what's going on. So, okay, let's talk about some of the good. What were some of the positive effects that came out of this last year? And you might be thinking, nothing, but there were some good things, right? We had a renewed commitment to workplace safety. There may be things that we never addressed before that we needed to address that we finally did. Improved communication channels, certainly, because that communication was crucial in this last year, and we may have found other ways to make sure that our staff was staying informed and really just buckling down on that. Maybe some new benefits that maybe we decided to roll out for our employees, such as additional PTO or a hazard pay or any other sort of premium pay. Having those positive relationships with our staff. There were a lot of conversations and dialogue in this last year that maybe we wouldn't have had otherwise, and ongoing trainings that maybe we wouldn't have had. There were a lot of flexible approaches to work schedules that came out from this. Now that might not have been, didn't seem like a positive effect at the time, but now that we've worked through it and we have maybe changed some things, this could be something that we could put in for the better that might make scheduling easier for us in the future. And then certainly those updated policies, like I always say, sometimes we create policies, we put them on the shelf, and then there's dust on them. So making sure that we looked at them and we updated them, which we're going to talk about some specific ones today at the end of the webinar. So let's talk about that effective communication, because all of those litigations that I just showed you on that page, most of the time it comes from lack of communication and misunderstandings. So what was the impact of that ineffective communication, not only in this last year, but always in moving forward? We have safety issues, compliance issues, disengaged employees, and misunderstandings, and so on and so forth. And which ultimately leads to employee turnover. So we know that communication is crucial, and especially in this last year, back to my HR #1 rule of the documentation. So every time that we trained our employees on a new process in regards to COVID or anything else, we had to document that. But that meant that the communication was improving. So it is so important to make sure that we improve that and that we sustain that moving forward. Let's not go back to normal if normal wasn't good in terms of communication. So how about that effective communication? When we have those good open dialogues and that effective communication with our staff, builds employee morale, satisfaction, and engagement. So in all of those things, but also the tangible things, because they are trained better, we have less safety issues, it gives the employees a voice and a way to talk about what's happening for them at work, and it avoids those misunderstandings. If we have open communication with our staff, then the conversation's happening. And we know a lot of times it's just misunderstandings where things can go awry. So really, it improves our processes and procedures and ultimately creates greater efficiencies, which we know reduces cost. So it may seem like a simple thing, oh, better communication, but really it trickles down and does mean a lot. Okay, so let's get into the nitty-gritty here. Let's talk about these updated guidelines and what it means for your business specifically. So just to clear up some things, because sometimes we get overwhelmed with what the CDC says, what the Governor DeWine is saying, what's coming out of OSHA, what's coming out of the Department of Labor and Department of Health, and so on and so forth. It can be very overwhelming. And as we know, the governor will come out and have a press conference, and then something may change the next day, which is why we have our disclaimer in the front. This is current as of today's date. So the CDC gives the states the guidelines, and then the state enacts the regulations that they wanted to put in place. So that's kind of how that works, very simply stated. So the CDC updated their guidelines for businesses. So businesses settings may choose whether they're going to continue to require masks and social distancing for their employees and their customers. So now as business owners, we have a choice. Unless, of course, anybody today on the webinar is in healthcare, as you know, you do not have a choice just yet. Nothing's changing for our healthcare businesses just yet. So that was CDC's updated guidelines. So what did we do then for Ohio? So then the Ohio Department of Health, they'll come out and they'll say, based on those guidelines, here are our regulations. So personally, they said we can stop wearing our masks if we're vaccinated, fully vaccinated, which we're going to talk about in a minute here. And that if you haven't been fully vaccinated, that you should still wear your mask and socially distance. So of course, Ohio is reflecting this recommendation that everybody wear masks when they're in a healthcare setting, regardless, again, healthcare, in public transportation, or at a business that requires it, which we're going to be talking about in a minute. And then there's that magic date of June 2nd. That the mandates, of course, will all be lifted. So what does that mean for our businesses? Okay, so let's get to that. So we are allowed as business owners to decide whether or not we are going to require masks. Now, as you may have heard on the news already, there's already large employers saying, we're done. Walmart, such and so forth, we're done with it. We're getting rid of everything. But you do have a choice, and I wanted to make sure everybody was aware of that. If you do choose to require masking for your employees and customers, that is totally permitted. You can do that. And if you choose not to have require masks anymore for your customers and your employees, that is also permitted. So that is a choice that will have to be made. If you're not in healthcare. As advised by the CDC, Ohio's order also continues to require masking in those nursing homes, assisted living facilities, and if you're around a large group of unvaccinated people. So that's the choice that you'll have to make. So let's talk about that. So if your business requires non-vaccinated people to wear masks in Ohio past June 2nd, they state you should have a sign up similar to the signs that we have seen the last year, stating this: unless the individual is fully vaccinated, all persons are required to wear a facial covering and engage in social distancing at all times. So that's what your sign should say moving forward if you do choose to have masks at your business. So here's the question: how do we know who's vaccinated, right? How do we know, and how are we going to manage that? Again, so if you decide that you do want everyone to wear masks if they're not vaccinated, here's the recommendations. So how can we determine whether guests are fully vaccinated or we'll get to the employees here in a second. And cleared for a maskless experience, you really only have a couple options here. So again, if you have customers and guests coming into your business and you want to put that sign up that says all unvaccinated people still need to wear a mask, here's really your options. You just say all guests have to wear masks. That's one option. Your other option is you say you have to show us proof of your vaccination, i.e. the vaccine card. Or 3, the honor system. Those are really your options. So as you can see, this is why most businesses will probably say masks off, we're no longer doing it. This does not mean that people personally can't continue to wear them, as we know. Okay, so let's talk about those vaccinations and what this means for your employees. So what is fully vaccinated? So according to the CDC, a worker, so your employees, are considered fully vaccinated 2 weeks after they've received the second dose or 2 weeks after they received the 1-dose vaccination. And as it stands right now, there really is no limit on that fully vaccinated status, i.e. the booster shot that we keep hearing about. Oh, is this going to come? So we don't know that yet. So right now, fully vaccinated is what you see on the screen right now. So to mandate or not mandate, this is a question that we get from some of our SBDC clients, and you may have seen some of this on the news or read about this on your own. So your choices are to either mandate the vaccine, strongly encourage if you want to, or maybe you're not speaking to it at all. So if you do choose to mandate the vaccine for your employees, keep in mind you have to make accommodations for those employees who are abstaining due to a legitimate medical or religious reason. Okay, so that meaning not everybody will be able to get the vaccination if you are indeed mandating it. So businesses will need to take these accommodations into account too if you're going to have some sort of policy on it. So workers who are unvaccinated and thus required to continue wearing their mask and maintain social distancing could have a claim for retaliation if there's any sort of discrimination in violation of any federal safety laws or any other legal principle. So just keep that in mind, that if you're going to do this, there may be some issues down the road from that. So how are we going to track vaccines? Because if we're going to track vaccines of our employees, this could raise some privacy issues and other concerns. Now, we've been talking about this a lot the last year because we've been taking our employees' temperatures, which if you would have told us this a couple years ago, we would have thought that was crazy. We can't take employees' temperatures at work when they come in the door. So a lot of things have changed in this last year due to us being in a global pandemic. Of course, we're in an exception. So if you want to provide the mask and the social distancing relief to your fully vaccinated workers, you have to determine who has the vaccine. So if we're not going to use the honor system because that might not be best, you have to, of course, get some sort of proof. So what are some of those best practices? We have to be careful when we're talking about anything medical related with our employees. So first and foremost, we are allowed to ask for documentation. We are allowed to do that. But when we do this, we need to just think about some things. We want to make sure we treat this as a confidential medical record. Don't make copies of it. Simply have a spreadsheet that has who has the vaccine and who does not with their shot received and their last dose. Refrain from asking any follow-up questions. Do not ask their reason of why, they're not being vaccinated, anything that could trigger anything under ADA or any sort of Non-Discrimination Act obligations. And also, and this is kind of the hard one, because we've all, those of us who've been vaccinated, who maybe got that second dose and we were feeling a little sick, we may be concerned about our employees' well-being, but really try to refrain about asking your employees how they did after they got the vaccination. Hey, how'd you do? How'd you do after that second one? We've all been talking about it out there. As harmless as this question may seem, this really may reveal some sort of disability status that's probably best that you don't know if they don't want you to know. So really less information is best when it comes to tracking the vaccine, if you choose to track it. So again, if you have a workplace where you still have employees that want the vaccination or need the vaccination, and they're going out there to get it, there are some recommendations from the Department of Labor to just consider scheduling vaccine appointments before people are going to be off for a couple days. It has been known, of course, once you get the second dose, that people are feeling ill, which we're going to talk about here in a minute. Stagger those appointments so not everyone's going at the same time. And of course, you can inform those employees of some of the common side effects. So offer paid sick leave for those employees who are maybe need to be off because of the symptoms that come after getting that second shot, which we're going to talk about here in a minute. So this is the other tricky thing, because we know that we were required, some of us businesses, to give time off for COVID during this last year. But what about what's going on with this second shot? Because there are some people and some of your employees who have really maybe got quite sick, under the weather from that second shot. So let's first and foremost remember that as business owners and managers, we're not their healthcare provider. So let's not make any assumptions about how anybody's going to feel. Let's continue that empathy and support that we've been practicing this last year. And here's the other issue, because although we shouldn't think about things such as vaccinations and healthcare as being a hot topic or even political for that matter, sometimes it has been, and I think we all know that. So regardless of personal feelings that we may have of the vaccination or other employees may have, we have to remember that people receiving the vaccination, it was important to them. And it possibly even important to your business. So we need to keep our personal feelings aside when it comes to discussing things like vaccinations in the workplace. Okay, what you're seeing on the screen right now is taken straight from the CDC. And I typically don't like to put a lot of information like this on one slide, but I just wanted to point out the difference here. So you're kind of understanding what's going on with your employees. So these are the signs and symptoms that are not typical after receiving the vaccination. So it really any sign that's consistent with COVID-19, because the big question was, how do I know I'm not just sick from the vaccination or I actually have COVID? So any sign that's consistent with COVID, such as cough, shortness of breath, runny nose, sore throat, that loss of taste that people have had, those are not typical from receiving that second shot. The things that are typical after receiving that second shot are just some general symptoms, maybe a low fever, fatigue, headache, chills, and body aches. So that is typically what the CDC has seen from employees getting the second shot. So what does that mean for you? So let's put it in a nutshell. What does that mean? So in a nutshell, your employees will typically be back on their feet and without symptoms after the vaccination, after 2 days, probably 3. And those of you on the call right now might be thinking, yes, it took me 2 days, or I know someone who it took 4, and that very well may have happened. On average, they're seeing 2 days. So if your employees are coming to you after 2 days and they are still feverish and they are not consistently getting better each day, it might be time to advise them to seek medical treatment and have them off work, maybe until they take a COVID test. It may be more than just the symptoms after the second shot. So in a nutshell, that's what the CDC is recommending. And that's what was just on the screen. And again, you will get a copy of these slides. So it should take about 2 days and they should be back on their feet. Okay, so here's some questions that we're getting at the SBDC. Do we have to provide paid time off to employees to get a vaccine? So if you are requiring the vaccine, the Department of Labor recommends that you do include the time spent getting the vaccine as hours worked and cover the cost of the vaccine, which, as we know, hasn't been any for most of us. So let's say there. So here is, if you're requiring it, then you should. If you have a voluntary vaccination policy or really no policy at all, and the vaccine is not directly job related and consistent with your business necessity, then you likely will not have to pay your employees for the time off that they go to get their vaccine. You can always do so, always. People have been doing a lot of things differently this last year that maybe they wouldn't have thought about before in order to show that good faith effort and support of their employees. So with that being said, let's remember our HR golden rules, and that is to be consistent. So if you're paying someone to get their vaccination, you need to be paying everybody their time that they took to get their vaccination. We can't pick and choose who we decide we're going to pay for. So let's talk about some other common workplace issues that we've been seeing lately. So finding employees. That has been a huge issue, especially since our businesses have really opened up, these last 6 months and moving back. The lack of applicants out there has been a very crucial need for all of our clients at the SBDC and the clients that I work with through Forbes HR. They just cannot find the staff. Not every business, but a lot of our businesses. So a lot of the blame has been put on those enhanced unemployment benefits and other reasons as well. But that is ending at the end of June. So I think, I just read an article this morning that there's going to be now this surge of people who are going to be back on the job market and looking for that job. So I think there will be an end to some of that. We're always looking for qualified applicants, of course. We may always have a need, but some of that may be alleviated here pretty soon. So let's talk about this refusal to return to work, because I have helped a lot of our clients complete this form because, frankly, they just have employees who are refusing to come back to work. So what does that mean? So the Ohio law states that individuals are not entitled to unemployment benefits if they have resigned or have declined an offer of suitable work without good cause. So if they're frankly just not coming back to work because they don't want to, they're enjoying those unemployment benefits or whatever other reason, we have to report this on the ODJFS website. And that's the link that you're seeing on the screen right now. When you go on there, you'll put that you've offered employment. You have to have all of the information for your business as well as the person that you offered the employment to come back to work. The ODJFS will then investigate and send both the employer and the person who is out on unemployment a determination of whether or not their refusal to work was for good cause. So similar to appealing an unemployment claim that you may have in the past, or filled out an unemployment form that you have in the past, this is similar, but this is more about our employees who are out and refusing to come back. Notice the good causes in quotes, because that is what the ODJFS will decide, not us as the employer. So let's talk about those employees who come back and maybe they decide not to get the vaccination and they're still wearing their mask, or maybe they got the vaccination, but they still want to wear their mask. Again, as I mentioned before, this has kind of been a hot topic, a heated topic amongst people. Unfortunately, it did turn political as well. And we have seen, frankly, we've seen families, be at each other for their difference of opinions and these types of things. So you want to make sure as a business owner that you're mindful of what's going on. So if you have employees that are choosing to still wear the mask because they want to, we have to make sure that we're not seeing any sort of harassment, even that typical picking on or that type of thing, or any, of course, any sort of retaliation against them or discrimination. But we really want to make sure that we're monitoring that and we're not seeing any of those actions take place in our workplace. Let's think about the litigation slide that we saw earlier on. We do not want to be caught up in something like that, as simple as workplace conflict over something like wearing a mask. Okay, this seems to be the golden question that we're seeing a lot here. How long should we let our employees work from home? So really only the business owner and leadership can answer this question. But if it's still beneficial to your business and your employee appreciates the flexibility, consider that remote work to continue. For some businesses, you may have heard some businesses, frankly, sold buildings over COVID. They didn't need them anymore. The cost of having the business open in a building and the rent or the utilities, it just wasn't worth it. So that's, the first thing. But the second thing is the reality of it. And most of our businesses, that we assist, that's not an option. They have to come back to the workplace. So if absent a need to work remotely as a reasonable accommodation under the Americans with Disabilities Act, employers are not obligated to allow telework. Notice remote work, those words are interchangeable. Notice I said absent a reason under the ADA. So as we know, the ADA has been around a lot longer than this recent COVID pandemic. So we have been accommodating employees under the ADA for some time. This is not new news. So what's going to happen is we will treat this just like any other accommodation, that we would have to do an interactive process to see if we can still support it. So the short answer is yes, you can have your employees come back to work. If there is an issue under the ADA, there needs to be an interactive conversation. So my employee wants to continue to work remotely but everybody else is coming back. What should I do? So similar to what I was just talking about. So as long as the employer can indicate that you have your safety precautions are followed, there's really no criteria to keep them from coming back to the office. If you have someone that has that underlying medical condition and they're still susceptible to COVID, we would talk about the accommodation just like we would anything else under the ADA. You want to have that open dialogue and that interactive process with your employees about their reasons for wanting to continue that remote work. If there's not a medical need, it may be time for you to put a deadline on that remote work. But I caution this, like any sensitive workplace issue that you feel is going to turn into an ongoing issue, or you just frankly are not getting anywhere, always consult with an attorney before taking any sort of drastic actions, especially a termination. So the extension of the paid sick and family leave tax credits due to the American Rescue Plan Act. So you may have heard of this. You probably recall the Family First Coronavirus Response Act that put in place. That did end in December 31st. That was giving employees time off under the Family First Coronavirus Act if they had COVID, take care of somebody with COVID, or if their child was out of school due to COVID. So that ended on December 31st, but employers were able to continue it and still get the tax credit through March 31st. This new American Rescue Plan Act has now extended that to September 30th. And it also added that if you need time off to recover from the COVID vaccine, that falls under this as well. So that means you as the business owner will still receive that tax credit through September 30th if you're letting people off under the FFCRA. And then the COBRA coverage and payroll tax credit as well. And both of these things are things that your accountants can help you with. This law gives 100% premium subsidy for those COBRA continuing health insurance through September. So if you have employees that were terminated due to the position being eliminated through COVID, those COBRA payments would be paid and you would receive that subsidy. So let's talk about mental health benefits for employees here for a minute. So the number of cases of anxiety in the US tripled as a result of COVID-19. That was a study through Boston University. So I always recommend, if you don't already, having an employee assistance program for your staff. It is a very inexpensive benefit that is often underutilized at many businesses. It can be around $2 per employee per month. That's how inexpensive it can be. And it provides confidential free counseling for your staff in all of these areas that you're seeing on the screen right now. Coping with change, depression, family conflict, grief, any sort of relationship, just stress. And we have seen so much of this over the last year due to COVID. Always remind your employees of what their benefits are, including their mental health benefits, and always remind them that it's confidential and that you support the time that they need to use the EAP. Again, there's wonderful EAPs in our area, and I'm sure if anybody on the call today is not in Mahoning County or the Youngstown area, I'm sure in your area as well. I highly recommend having an employee assistance program for your staff. Please just kind of be mindful of your staff during this time. If you're noticing anything, if you're hearing it, if another supervisor or another employee comes to you with concern, and you're recognizing some of these signs, if you have something like the EAP benefit, you are certainly, and they recommend, handing your employee a card and saying, hey, why don't you give them a call? That is perfectly fine to do that. We need to consider this culture of empathy and support that we have started this last year. Okay, so I promise we're going to finish up with some policies to update now. So we have been through a lot in this last year. So what are some of the things that we need to talk about? If you've come to any of our webinars before in regards to this, you've heard me talk about business continuity plans. This is the time to do an after action analysis. Sit down, look at that business continuity plan, update any of the resources, the phone numbers that are in there, make sure the contact information is up to date, make sure that you establish some sort of pandemic task force so we can continually monitor, keep our finger on what's going on with all these regulations, and just keep having those drills. We had fire drills when we were in school. Keep having those drills and making sure that everything we need is in that business continuity plan. So if we ever had to walk out and close the door again, like we did in March of 2020, then maybe we'd be a little more prepared. Okay, let's talk about those IT policies. So there were some IT folks working overtime this last year, making sure people could work from home, that they had everything that they needed, that data security practices were tight. We were working from home. We may never had to have done that before, making sure that we had all of the malware and virus protection on all of our computers. And make sure we're doing those periodic cybersecurity audits. There's been a lot of cybersecurity issues over the last year as well, in case we didn't need anything else to deal with. So make sure you have all of those policies up to date on how employees can use their personal devices for work as well, because it could have been before that they weren't allowed, and now things have certainly changed. And that's because of remote work. So if you never did get around to creating that remote work policy, please do it now. Have that everything outlined in there, that what the expectations are for that employee while they are out. You may need to do a specific expectation sheet for specific employees depending on their position. And again, this could be helpful in the future. You saw how it worked. This could alleviate someone having to take time off of work because now they can work from home. Or maybe somebody is having some sort of medical procedure. Previously, they would have needed 6 to 8 weeks off. Now maybe they need 2 weeks off, and then they can work from home. So this really has given us some flexibility in the workplace that maybe we didn't think about before. And then, which leads us to our employee leave of absence policy. Again, make sure we have our leave of absence policy if it's relevant to us. Even if you're not an employer who has to fall under the Family and Medical Leave Act because you don't have enough employees, 50. A lot of small businesses still have some sort of leave of absence policy because employees, frankly, will need time off from time to time. So just make sure that you have this up to date. if you are going to provide remote work, make sure those policies, mirror each other, they actually coincide with what the expectations are. Look at those attendance policies. You may have changed those over the last year. Tailor the policies that are unique aspects of your business and your culture. Again, like I said, every industry and every workplace culture is different. Look at your wage and hour policies. There have been people who maybe bought some things from home to work from home in the past year, whether they're going to be reimbursed for those. Have those conversations, making sure the meal and the rest and the off the clock work those are things we really didn't think about before when our hourly employees were working in the office. But when they started working from home, that became an issue. Again, let's think back about that litigation slide that I had in the beginning. So many workplace claims due to people working from home, off the clock and through their lunches and not getting paid from it. Let's talk about the hours worked for symptoms screening. I recently just saw a case that's coming over because somebody said, hey, I stood in line every day before work for 15 to 20 minutes waiting to get my temperature taken, and that adds up. That added up. So now we're starting to see cases about people who had to come in to get temperatures taken before work and weren't paid for the time. So that's another thing to think about. So let's keep that in mind with our wage and hour practices. Make sure we train our managers. They have to be in the loop with all of these things that we've been talking about and all of these compliance issues. It can't just be the business owner. It has to be everybody that understands the expectations and the policies. Workplace safety. If we haven't said it once, we've said it, thousands of times in the last year. So many policies have probably changed at your place of work due to workplace safety, increased sanitation practices, new inspections and trainings and record keepings and checklists have probably been there. And if they didn't, now is the time to think about that. What can we do to ensure that we're doing all the things that we need to do? Even if we don't have to do all of that sanitation that we had to do during COVID, even though it's still here, those are all important things to alleviate any virus, really. So we want to make sure that we're doing things, that we're documenting it. And again, this is an improvement that I think came from that. And any sort of general infectious disease policies that you may have at your workplace, you want to make sure those COVID-19 provisions are in there. So can we look beyond COVID-19? I think it's time that we can. We want to be confident in our business. We want to bring our employees back to work. They're confident in you. You're confident in your business that you've been doing all of the right things, that you're going to continue to do all of the right things to ensure that safe workplace. And think about the positive effects that we talked about, and think about what we've learned over the past year. What do we need to change? What can we keep that was the same, and maybe what we'll go back to before? So really ask yourselves those questions. Sit around the table with your colleagues that make those types of decisions with you, and really and think about that. And let's continue to think about any challenges that may come ahead. So some final reminders before we go. If you have any questions, please throw them in the chat box right now, and we'll get to them here in a minute. So continue to be empathetic to the situations and keep that open dialogue with your employees. Be supportive of your employees and of your customers, the wide range of people and their needs that we will be dealing with as business owners. Maintain awareness of these ongoing regulations and best practices. We don't have to know every single thing and memorize every single day, but try to make sure that you're watching the news and you're keeping up with what's going on. Always reach out to us at the SBDC if you have any questions. Don't let all that hard work that you've done in the past year disappear. Maintain vigilance of those practices that you put in place to improve processes and procedures, and consider keeping the ones forward that were really beneficial for you. So let's not just say, we did that for a year, let's put it aside. Let's maintain that, what we've done and keep it moving forward. These are all of the resources that I had the information from today. That feel free to go on there yourself and look at the great information that's on there. Again, you'll be getting these slides, so you will see that. And please, if you joined us today and you enjoyed the information, which I hope you did, I hope you come back for our second, third, and fourth webinar of this series. On June 3rd, we're going to be talking about the best practices of hiring seasonal employees and creating internships at your place of work. On June 24th, we're going to be talking about ensuring an accessible workplace. I talked a little bit today about the ADA, and that's what we're going to focus on that webinar. And then on July 22nd, we're going to be talking about the best practices of having an employee training and development program. I'm sure you'll be getting the link directly from the SBDC. There's the link on the screen today as well. If you have any questions, again, please put them in the chat room. I will stay on for a few more minutes if anybody has anything. Always reach out to us at the SBDC. This is Pat's information here. She's the director of our center at YSU. Here is my information here on the right, my phone number and my email. Always feel free to reach out to me. If you have any questions about what we talked about today or any HR questions in general, I'd be happy to assist. So with that said, I want to thank everybody for joining us this morning and ask Jenna if we had any questions that came over.
Hi, Joanna. So I was looking in the Q&A in the chat, and it looks like we don't have any currently, but just as Joanna said, just to echo what she said was, please feel free to reach out to us or to Joanna, and we look forward to having you join us in our next webinar on June 3rd. So thank you so much, Joanna.
Oh, thank you, Jen. Thanks for having me. And I will stay here for a few more minutes. If anybody has anything, I'm not going anywhere. So thank you so much.
Okay. Okay, so we had one question pop up in the chat. It says, heard recently of an employer offering 2 additional personal days per year to those employees who get vaccinated only. Union said that's okay because the employer can offer incentives. Any thoughts on this?
This would be, there are incentives. I mean, as we know, the $1 million incentive that the state's giving or the tuition incentive. But when it comes to businesses, again, I'm a big proponent of being consistent and documenting. So if you are going to do something like this and you have a collective bargaining agreement, such as a union, which was in the question, and the union says it's okay, then move forward with it. If you don't have a collective bargaining agreement at your place of work and you're a private business, you are certainly in your rights to offer incentives to employees. I caution the employees who cannot get them due to medical reasons and religious accommodations. That may be an issue. Because they are more than willing to get it, but they are unable to, and that may cause an issue for you. So I would want you to be prepared for that issue if it did come to light. That would be my personal opinion on that.
And we have another question in here too. It says, should we have language about falsifying vaccination information if we go on the honor system for masking for non-vaccinated employees?
Should we have language about falsifying vaccination information if we go on the on? Okay, so I think what they're asking is if you have an employee that just frankly lies and says that they have the vaccination in order to take. So first and foremost, what this is telling me is that this business wants to, they're going to say, if you were vaccinated, you can take your masks off at the office. Okay, so if we're going to say that, that means that if you weren't vaccinated, the expectation is that you are going to wear your mask in the office after June 2nd. So I think what they're saying is, it's after June 2nd, my employer wants me to continue wearing my mask if I haven't been vaccinated. I haven't been vaccinated, so I'm going to lie and say I was. I think that's the question. Yes, I would have language in your policy that states that if the person falsifies their information, that there could be consequences for that per your corrective action policy. Just like lying about any information to your supervisor in the workplace would probably lead to that. So, but as I said, remember first and foremost, if you're going to have it that non-vaccinated people have to continue wearing their masks for the time being after June 2nd, then if you're going to just do honor system, then you find out that they lied because they said, aha, I got her. You find out some way, yes, there could be some sort of consequences. Now, are you going to fire that person? Probably not. Are you going to maybe pull them aside and have a conversation? Yes. At least to start the conversation. Think of this as any other PPE. So if we worked in, manufacturing and we required our employees to wear a hard hat and goggles, and they started not doing that, even though we were, they would be, spoken to through the corrective action policy, just like anything else. So yes, you're right. Good question. Both of them.
And Joanna, I think that wraps up our Q&A, but also if anybody has any further questions, feel free to reach out to either the center's email or Pat's email, or even Joanna as well. So I think that will conclude our webinar today. And Joanna, thank you so much. And everybody, we look forward to you joining us on June 3rd as we continue our part 2 in this HR webinar series.
Thank you. Thank you to the SBDC.
Okay, have a great day.